Good afternoon. It is 12 p.m. on Friday, June 12th, and I just thought I'd let that music play just a little bit longer. I want to thank our technician, Alejandro, for giving us that music. I think it gives us kind of a time to breathe for those of you that had joined us a little bit earlier before the 12 o'clock hour. We appreciate you for joining us today. My name is Yvonne Lewis, and you can see here the information. I'm serving today as a moderator, as a co-director for the Community Core, the Healthy Flint Research Coordinating Center, and we certainly welcome you all here today to our webinar. We have been together now for some of us for 13 weeks, looking at the issues that face us as a result of the coronavirus. The Healthy Flint Research Coordinating Center is excited to bring this opportunity to you, and hopefully you have found it beneficial as our goal is to bring some relevance to this nationwide, worldwide issue, the pandemic of the coronavirus, but with a local context. So we certainly appreciate you for joining. We also want to say to you that your questions and comments have helped to guide this webinar every week, and it's been so beneficial. We've had a number of community agency and organization partners who have joined us every week. And for those of you that are listening via phone, you may not be able to access the actual webinar panel slides. So I want you to know today that available to answer any questions that you might have are Dr. Deborah Forholden from MSU, Division of Public Health, Gary Jones, who is out of Governor Whitmer's office, Kim Van Slyke and Susan Cooper, who are from the Genesee County Health Department, Clarence Pierce, who's the CEO of Hamilton Community Health Network, Dr. Lawrence Reynolds from the city of Flint. We've also have Isaiah Oliver from the Community Foundation of Greater Flint, Sharonda Grigsby, who's from the State Office of Equity and Minority Health, Dr. Susan Wolford, who's a physician at U of M Medical School, who has been providing for us a medical perspective, and she's also a co-director of the Healthy Flint Research Coordinating Center. Nicole Smith Anderson from the Greater Flint Health Coalition, Dr. Rick Sadler from MSU, also the Division of Public Health. We've had Tracy Jackson from Metro Community Development and Jim Melanowski from the Genesee Health Plan. Each one of them are here today to answer questions that you might have. We're also happy to have Kirk Smith join us today, who is the CEO of the Greater Flint Health Coalition, as well as Brian Larkin, who is the Chief of Staff for the City of Flint. Harmony Lloyd is also with us today from the Mass Transit Authority. And so you can see we have a number of community partners who have great interest in ensuring that you, the community, have information that is much needed. I wanted to bring something forward today. And again, let me say, for those of you that are called in and you can't see and you want to ask a question, you can call or text your question to 810-835-2130. That's the National Center for African American Health Consciousness line. And we'll be happy to get your questions into the webinar today if you're not able to access that Q&A button. We want to again acknowledge and appreciate each one of you. And today I wanted to raise something very, very important to you. The Healthy Flint Research Coordinating Center, as we've talked about this over the few weeks, is a multi-institutional partnership led by a strong community core and academic partners, the University of Michigan, Flint and Ann Arbor campuses, as well as Michigan State University. And it's so interesting that we have two major institutions in our community that for most of us who are in Michigan have been rivals for years, that have come together to work collaboratively with community to look at research. We're also living in what I call the trifecta. And I know for those of you that may not follow racing, that's a term that's used in racing. But we are faced with three major issues right now that have come together, three major events that have come together to create this space that we're now living in. 5+ years ago now, and maybe even longer, 2014, that's six years ago, the Flint water crisis. And a few months ago, the onset of the coronavirus. And in these last couple of weeks, we've seen an uprising based upon the injustice and racism as we saw a man dying in front of us on national television. These three issues, these three events have created an interesting space for us. And so we want to talk about it a little bit today in terms of research. And many of us have been concerned about research, just because research has not always been the most favorable conversation for many people. But with the work of the Healthy Flint Research Coordinator Center, we want you to know that we need your assistance. There's a number of things that we focus in on, and you'll see here these different kinds of research efforts: community engaged research, community-based participatory research, community-based participatory approaches to research, community-initiated research. And then we also talk about randomized clinical trials. We've got surveys, a number of ways that research is done. And really, research is, and I'm gonna put it in very simple terms, it's an investigation. It's a way to answer questions in a systematic way or an organized way to get some answers that can be replicated. And all of us know right now we need good answers that can be replicated in a positive way that makes change for our community. Your voice matters to us. And so that's why every week we take the time to listen to your questions and incorporate some of the questions that you have into these weekly webinars. We appreciate you and want you to continue to help us and consider how you might participate in helping us answer some of the questions that we're facing today. We don't want to 5 years from now, 2 years from now, or even a year from now, look back and say, oh, what if we had asked this question? I'm encouraging you and asking you to help us ask the questions today that we can work together collectively to identify the answers. We have with us one of the other co-leaders of the Healthy Flint Research Coordinating Center, who is an epidemiologist and a researcher from her heart. Very, very interested in what's happening in our community and being a champion for our community in so many ways, and in rooms that many of us may never sit in, but has the opportunity to help us make a difference. Dr. Deborah Verholden, as a co-director of the Healthy Flint Research Coordinating Center, is also on the Michigan Corona Task Force of Racial Disparities and a number of other initiatives. And I'm going to ask Dr. Deborah if she would now just share with us what some of her insights and key things that, again, during this season, with all of these things in mind, what do you say to us today?
Well, thanks for having me, and thanks for everybody that's here. I was going to talk a little bit about reopening, and my wonderful colleague from the city of Flint, Brian Larkin, is on. So I'm just going to reiterate the same message because it remains unchanged. I did want to make a quick comment. I heard that I read the article that the World Health Organization put out saying that basically that people who were asymptomatic were unlikely to spread the virus. They have recanted that statement. I will tell you, it had a lot of us in public health up in arms. I remind people that this is a new virus. You know, MSU has a school of veterinary medicine and a school of osteopathic medicine and human medicine. And the area is called One Health. It's the intersection of humans and animals in our environment. This virus was introduced into the human population, and we are all still learning. I describe it as we're changing the tire while the car is moving. And we're also learning how to change the tire and trying to change it while the car is moving. So, you know, that statement has been recanted, and they are very clear. We don't have enough data or information to be able to say that. So it's important now more than ever as we move to reopening that people really practice personal protection. And I think we all agree that the call to action in social justice right now is important, and you can still practice personal protection. So the basics: wash your hands and sanitize your hands when you're outside of the home. Continue to use your personal protective equipment and make sure that you use it properly. Apply your mask from the strings. Take your gloves off without making contact. Continue to practice physical and social distancing. Continue to work on boosting your immune system. Maintain the healthiest diet possible. 30 minutes a day of physical activity. Limit alcohol consumption. No smoking. Stay abreast of the current information. This webinar is one format, but please do continue to be in communication with your healthcare provider. It's now more important than ever that people continue to get primary and preventive care. If you have pre-existing health conditions, continue to keep those conditions managed. This is not the time to stop your normal routine of care, exercise, telehealth, if that is an option for you. And then most importantly, make choices that make sense for both you and your family. We know a lot of people have been participating in demonstrations and protests, etc. Please make sure that you are keeping yourself as well as others in your family and in your home safe.
Now, Dr. Deborah, I just want to just ask you to touch on this a little bit. And we hadn't had a previous conversation about this, but I know you can field this question readily. It's when we talk about community engagement as a scientist, as a researcher, with the climate that we're in, how important is this to you to have community members across our community be involved in this effort?
I think it's critical because who wants things done to them or on their behalf without their permission? And so I think, and a lot of people have asked about opportunities and how to get engaged. I think the voice of the community is important now more than ever, and people should be a demand. We talked earlier about how 50% of Americans said when a vaccine is available that they were not going to get it. And in the absence of that, we're looking at about a 2-year process before we can kind of get to the point where we've got a sufficient level of community protection. So people's concerns are important now more than ever. Their voices, people chiming in on what's happening, it's important now more than ever. This is something that has impacted all of us. And I think the voice of the community right now is really, really important. So I would encourage people, be a demand for a seat at the table.
Thank you. Thank you so much, Dr. Deborah. Now, one of our panelists is going to have to leave us a little bit early, so we want to move to have a conversation with I'm going to call you doctor today, our brother Clarence Pierce, because when you talk about community voice, one of the ways we show our voices is in action. And one of the things clearly our community said is we want to be sure that we can get tested. And so we want to have, we want to talk to Brother Clarence for a few minutes because he is the CEO of Hamilton Community Health Network, which is one of our federally qualified health centers in town. And they are standing up testing sites. And it's important for us to understand and utilize these sites. So Clarence, can you give us some insights on what's happened and the new testing sites and some of the protocols that are now shifted in order for us to get testing? Clarence, you might have to take yourself off mute. There you go. There you go. I hear you now.
Okay. Thank you, Yvonne. It's good to be with you again today and, try to get the message out to people in the community. We at Hamilton, we're continuing our testing at 2 locations. Our North Point location up there at 5710 Clio Road, that's our North Point Center. And at our Burden location on the south side of Flint, we're at the we're at the fire department there at Bristol and South Saginaw Road. And the testing is going well. We would like to see more people at our Burden location. We are doing fairly well at our North Point location, although we do have some additional capacity that we could test more people. We are doing the nasal test in the mobile part of our clinic, but our facility is right there. And so if someone needed the serology test, we would be able to do that, but it would have to be in the clinic. We would not do that at the drive-through. The drive-through is mainly to try to get people tested sort of in a convenient way where they drive up, get tested, and move on. The serology takes a little more time in that, we have to draw blood, which requires going into the lab and having a phlebotomist draw the blood and get it submitted. Yeah. One thing that we have put a lot of focus on, Yvonne, is making sure that our clinics are safe for the patients to return. When this thing first started, There was a lot of unknowns, and we had to do a lot of educating ourselves as well as our staff to make sure that we could provide a safe environment for patients to return. And we have done a number of things in terms of the social distancing. We have covered chairs to make sure that we can maintain that social distances, marked out the floors. We've put partitions up at the front desk so that we could protect our staff as well as our patients, because we feel that safety is a priority for us and our patients. So the patients can feel confident coming back that they will be safe and they don't have to worry about somehow contracting the COVID-19. The other thing that we're doing, Yvonne, is if it turns out that we're getting more patients in the clinic than we have chairs, we will work with patients, have them remain in the car until spaces are cleared out so that we can get more people in. We are trying to maintain that social distancing. We think that's so important, so critical to making sure that patients don't contract the infection. And so we're putting a lot of attention on that. We're wearing masks. We're asking patients to also wear masks. We're doing everything in accordance with CDC guidelines for the sole purpose of making sure that everyone is safe, and that's our patients as well as our staff.
Right. So Clarence, just a couple of quick things. You also, because you're a federally qualified clinic, you are taking people with health insurance, but you're also taking people who don't have health insurance. And then address quickly the issue. You want some ID, but it's not required necessarily that it is a driver's license or a state ID.
That is correct, Yvonne. We are taking uninsured patients. In fact, we would encourage uninsured patients to come in, because we don't want anyone to go without gaining access to whatever health problem they may have. ID, we are requiring some form of identification. It doesn't have to be a government issued ID, but any form of ID that you have, bring that in and we will accept that, and we will make sure that you get the health services you need.
Thank you, Clarence. I appreciate you taking this time. I know everybody is extremely busy, but you taking the time out to share this is important, because we want our community members to understand. But those of you that are working in these arenas, that you're touching people's lives every day, thank you for helping us get this word out, because if we don't use these resources, we could potentially lose them. So again, thank you so much, Karen.
Well, thank you, Yvonne. And look, we're happy to work with our partners and anyone else to make sure that our patients and our residents in this community are taken care of properly.
Thank you. Now we want to take this opportunity too, again, to thank Brian Larkin, who's the chief of staff at the city of Flint. We know that the city of Flint has been working on on strategies for the Flint community. And so Brian, welcome today. And if you could just unmute yourself and give us some insights on what's happening with the Blue Ribbon recommendations and other things that you really feel important for us to know today.
Well, thank you, Yvonne, and thank you guys for allowing me the opportunity to speak. I apologize, I'm going to have to run shortly afterwards, but I will touch base with you guys and see if there are any questions or anything that were proposed for the city, and I'll work on trying to get those back to individuals in writing or directly. As it pertains to the Blue Ribbon Commission, several individuals who participate in this weekly call with you have sat on different meetings with the mayor, as well as other members from the community, to help inform him and kind of give some guidance on some best practices for reopening both City Hall, but our city in general, really looking at how do we do this in a healthy way, in an effective way that helps to stimulate livelihoods, provide for quality of space, enhance the economy, but most importantly, protect life and protect health. So as you see on the screen here, as we're talking about buildings that have sat vacant for a series of time. So in a lot of cases, we have places that were closed or shuttered off. The very first thing we want you to do is looking at a deep clean of the facility, looking at sanitizing your surfaces and touching areas, and flushing your pipes, flushing your water pipes before you reopen them. That is really, really crucial, because as things can sit in the water, and we know that we're going to be relying on our water we're going to be relying very strongly on the water for hand washing and safety purposes. Adopting cleaning protocols, in addition to adopting them, having them laid out. We're going to have to start creating these habits and trends in our different places, in our places of work, in our public spaces. If you're opening facilities that public has access and use to, you're trying to encourage and build these habits into individuals who don't directly report to you but utilize your services. Having these clearly posted in spaces. For individuals who come in through City Hall, you'll see postings when we reopen it near our bathrooms. You'll see postings in our elevators about different things about your cleaning protocols, about your distancing, and kind of where to stand. Testing employees, Clarence laid it out very well about the resources that are available. There are resources throughout the community. It is a data point. The more data that we have around this unknown virus, as was laid out by our health community, the better we can do. So if you know, you don't want to knowingly bring that virus back into your work environment, back into your place of business or your community space. So if you can get, if individuals can get access to those testing, please utilize it as you enter. Ask guests to conduct a health screening before entering establishments. If anybody has gone to a doctor's appointment in the last 3 months or several other places, the screening is pretty straightforward, asking about the recent activity that you've engaged in, and I'm sure members of the HFRCC have those protocols as laid out either by the CDC or DHS here, or so if anyone needs those, but having those for your guests before they enter, mandating social distancing, in addition to mandating it, if you can do things in the facility that clearly indicate it, whether it's allowing spacing, with your seating, floor markings for lines, and things of that nature. Require employees and guests to wear masks unless they're medically unable to do so. I know there have been efforts by our philanthropic partners in the community to provide masks and making sure they're available to individuals. So if it is a cost burden to get some of the surgical masks, contacting our local partners. And I don't know if the system has been laid out yet or is in place, but there is a desire that we get as much mask out there as possible. I know different groups have had conversations, and even in the Blue Ribbon, there was our faith leaders have had conversations about what they can do to acquire some of those. Our community centers are looking at those, but having those available and requiring it. And again, it doesn't have to be a specific type of mask. I mean, the face coverings and things of that nature, scarves, we're just encouraging to have those sorts of wearing masks when possible. Eliminating shared items as much as you can, and then developing a response plan. We recognize that this is something unlike any of us have gone through in our lifetime, and that exposure could very well happen again, and we need a plan. To wait until something happens is a plan for failure, and so we really want to plan in advance that if we see things that move us back in those phases, as you saw the governor laid out, which you talked about reopening these different phases as we're moving forward, recognize that we can move forward, but it also could move backwards, and being ready to protect as many individuals as possible, having your workspace ready to set up to use some of the resources and strategies that we've had to rely on for these past 3 months, as well as working in those various ways. So that's what came out of our overall recommendations for the community as we're trying to open up. There will be specific instances that are individuals and communications that are pertinent to specific sectors. We're looking at outdoor things versus indoor things. When we're looking at dining, when we're looking at health and community spaces and faith-based. But these right here, these are recommendations that are good for all places, all entities, all spaces. And some of the more detailed ones will begin to roll out over time. In addition to that, and Yvonne, I'm not sure if you wanted me to get into any more of the reopening specifics, because another piece I wanted to touch on is some of the city's response to some of the social unrest. I haven't been able to be a part of the call since we've seen a lot of our demonstrations, and wanted to just kind of inform on some of the city things with that. But is there anything else on this first?
No, I just want to support the fact that what you said is the city is taking its time to develop a responsive plan. So we appreciate that. And certainly, please help us to understand that broader conversation in the context of the social issues that are happening in our community as well.
Yes. So as it pertains to the social unrest, the racial unrest, the Black Lives Matter movement, the protests, the marches, things that have gone on throughout the community, the city of Flint has been closely engaged in that. Mayor Sheldon Neely has participated in several of these events directly. Organizers have reached out to him and figured out ways that we can move. And one of the things that has been really, really important for us is to identify the ways in which action can begin to lead for change. And so some of the action steps, what I'd like to share today are just some of the action steps that have occurred. And I can share the documents. There's some documents to support them. I can share them with Yvonne. But there are a couple of resolutions that the mayor and city council have worked collaboratively on. One is a declaration of racism as a public health crisis, recognizing the public health implications and facts of that. And the purpose of this was really putting it in the proper perspective and taking it seriously enough, recognizing that this is just not a mild inconvenience or certain actions that just fit in a specific place, but this is a public health crisis for all. The next was immediately after the fact, and this was rolled out, I believe, 2 weeks ago, an ordinance that went through City Hall denouncing the use of illegal chokeholds. So recognizing that these chokeholds, the deals, and the actions that we have seen in the media that have caused the ending of lives of Black men at the hands of law enforcement are already illegal. But this isn't stating that we're going to make them illegal. This is really re-emphasizing not only are these illegal, these are being used improperly against parts of the community continuously. And so we're going to draw a notice importance to that. An action item that has occurred out of the city of Flint that the mayor has created, we've coordinated a Black Lives Matter advisory council and is taking open applications right now. And I can send the link over to Yvonne Lewis for community members to help. This is going to work closely with our police department, City of Flint Police Department, this advisory council, building a close relationship to speak about some actions and tasks and develop some strategies. It's really a strategy endpoint development for looking at these are things that will help. These are challenges that are existing, having that open dialogue and communication. That council is in the process of being created right now. They're taking open applications for community members who would like to serve on it. And the last piece, which is an ordinance that the city council has before them now, it's sitting in a committee right now. City council creates the ordinance, they're the legislative body of the city. They're working on passing an ordinance that prohibits biased crime reporting. And the premise behind that is saying individuals who are calling law enforcement to report a crime, and the only criteria of the individual or the suspect is that they are a member of a protected class, and race is a protected class. And here, recognizing that calling the police on the individual because they're Black with no suspicion, it's not just wrong and shouldn't happen. It will now be able to be prosecuted as well. It'll be a misdemeanor and a crime of sort. So these are 4 immediate responses that have come from the mayor talking directly and working with both city council, but community members, people who are panelists here, members who are in the audience viewing it just now, and the city is wanting to do some action, but also wanting this to be the beginning and how we can build a conversation and understand what are the tangible things that will have an impact after all of us are gone that can still help guide and help improve relationships moving forward. So those are some of the key things going on right now at the city. And we're just so happy that this platform is continuing to go on and healthy communication is being shared. If there are additional questions that people have or information that's needed, I'll continue to work and communicate directly with the coordinators and try to provide it as best I can. So thank you.
Thank you so much, Brian. You said so many very important things there. And just to capture a couple of them before you have to leave us, it's the importance of action steps, things that are tangible that will have long-lasting impact. So yes, we're really, really frustrated in many cases, and I think acknowledging this is really important. So we appreciate the city's acknowledgement and the action steps that you put forward. So I just want to reemphasize, if you can, there is an application process for the participants on the Black Lives Matter advisory group. And you're going to send us a link, but is there some place we want to tell people they can go right now if they want to look it up or begin applying to the process?
I'll pull it up right now, and then before I get off, I'll send it to you.
Share that back with us. So, okay, so
Yeah.
thank you so very much, and I hope our listeners can understand that the work that we're doing here through the Healthy Flint Research Coordinating Center community webinars is to help make sure that, I like this term you said, healthy communication is being disseminated, and we're going to depend on you as listeners and participants at the agencies and organizations that are represented to help us have this collective voice on healthy communication. I think that's so critically important. So we'll come back to you, Brian, for that insight, for that information regarding the Black Lives Matters Advisory Council that the city is organizing.
So I have the link now. The
Okay.
best way is probably if I can put it in writing. I think the chat is only open for people asking questions. But it's on the City of Flint page, but it'll be easier if I can provide you with the direct link.
Yes, and if you can put it in the chat, one of our staff will get it, and we'll make sure that it's distributed. That would be perfect.
Okay.
Thank you so much.
Okay.
Thank you so much. I want to just, again, when we talk about how do we utilize and activate ourselves, we were talking about the testing sites. And Clarence, and if you're still on, I'm going to check and see if you're still on. Yes, you're still here. Clarence, if you can unmute yourself, I'd like you to answer one other additional question. And then I want to call Harmony Lloyd from the MTA, because this is another important piece. When people have access, or there's something available, they need to be able to access it. So if there's a transportation need, she's gonna respond to that. But one of the questions that came for Clarence was, how often can a person get tested, and how quickly are we expecting to see results?
Well, Yvonne, we don't really put any kind of limit on the testing. The only requirement we have is to call in advance and make an appointment. Now, typically you will have the results back in 24 to 48 hours. And so far that's been very consistent. So we don't try to, limit the test, because it's our understanding that you could be tested, and within 4 days, even if you tested negative, you could still come up positive in, 3-4 days. So we don't want to discourage somebody from getting tested if they are feeling sick, or if they've been around somebody who may have been positive, or if, they're working outside of the home. So we want to make the test available for people.
Thank you so much. So if they're available, Harmony, we spoke a little bit earlier, MTA is still providing some support for transportation. Can you speak to us a little bit about that?
Sure. The headline of the day is that MTA is fully up and operational again. I hope you've noticed the buses around town, the Your Ride vehicles, the Rides to Wellness. We are fully staffed and prepared to take people to testing sites, to doctor's appointments, to the health clinic for other healthcare needs. And we have implemented extensive cleaning protocols and testing of our own employees and health checks. So we have making the public transportation experience as safe as possible for people. If you choose to use Your Ride, you'll be in a vehicle on by yourself it won't be a shared ride. So we just really encourage people that if you need a ride to any of these locations, please call us and use the service that's here and available for you.
Thank you so much, Harmony. As we're talking about services and availability, our health department has been an extraordinary partner, providing for us insights, updates on what's happening overall, and even specifics of what is available through this COVID experience. So Suzanne Kupel has just been our champion at the health department. So we're going to ask her to give us updates and some insights on additional testing sites. Suzanne. Suzanne, you have to unmute yourself. All right.
Hi, everyone.
There you go.
As of yesterday afternoon, we had 2,081 reported positive COVID-19 test results with 254 deaths. As you all know, we have made lots of strides getting testing in our community. So we have tripled our testing capacity in the community during the month of May and June. So that is good news. We encourage everyone to get tested. We do have an announcement of a change in location. So on Friday of last week, I mentioned that the Kroger location that was being hosted at Grand Blanc High School was going down, and it is coming up again at Mott Community College. That starts at noon today through 6 p.m., and they will be functioning Wednesday through Saturday from 12 to 6. The appointment process is through the Kroger website. So that is a new location. This location will be up and running through June the 30th, and then we'll be able to make some announcements about what happens after that date. You all know that we've discussed the Rite Aid pharmacy locations, one in Swartz Creek that's running 9 to 5 p.m. daily, and the location on Clio Road in Flint, which is operating 10 a.m. to 8 p.m. to accommodate those that work, and from 9 to 5 on the weekend, Saturday and Sunday. Michigan Health Specialists continues to offer testing. They also are doing the testing via appointment. And you heard from Clarence about the Hamilton testing at the North Point Clinic location and at the fire station, which is at the corner of South Saginaw and Bristol Road. The Walmart location is still up and running Monday, Wednesday, Friday, 7 a.m. to 9 a.m. Again, trying to accommodate people who work. And that process is done through the Quest Labs website. So that is also by appointment. We know that we have other community locations in the city of Flint that will be coming up shortly, and we'll be providing you more information about them as they come on board. I want to remind everyone that as the economy starts to reopen, our services at our buildings will start to reopen. The McCree South building is still providing service, and if you have any questions, just give a call to our health department for those services. The Burton location is providing services by appointment for WIC, family planning, immunizations, and sexually transmitted infections. We wanted to remind everyone that this is a new world. We are practicing social distancing and trying to accommodate everyone by appointment to keep everyone safe. So do know that when you come for a visit at the Burton location, you will be screened for temperature and asked some questions about your health, that we are limiting the number of individuals in our waiting rooms. Again, those things are being done by appointment, and we're trying to make sure that everyone is safe. You will need to wear a mask when you come for your appointment. If you are not wearing one, you will be provided one when you arrive. So do expect to have that screening process when you come for an appointment. I did want to share with you all that the Board of Health last Wednesday and the Genesee County Board of Commissioners this Wednesday passed resolutions declaring racism a public health crisis in our community. In 2016, the Genesee County Board of Health and Board of Commissioners adopted a policy in favor of health equity in all policies, and we look forward to sharing more information with you as we work on those issues moving forward. If anyone has any questions, I'd be happy to answer them.
Thank you, Suzanne. We'll be looking for questions, and hopefully our participants will be putting questions in the queue. We want to remind you that we have some wonderful panelists just sitting, waiting to respond to any questions that you may have related to the conversation we're having here today, or even some questions that we may not have touched on today. Please put them in, and we'll be sure that we do our best to get those answers for you. Kim Van Slyke is also on the call. And we've asked her, we've had a number of questions since she's been working with us on contact tracing and even monitoring, because one of the things that the health department is doing right now is to be sure that those who have been testing positive are being monitored. And so I've asked Kim if she could give us an update today to just provide us a little bit more detail on the monitoring process after folks have gotten tested. And then we can talk about some of the other questions that came up. So Kim, please.
Good morning, Yvonne. Per our conversation prior, a couple of the questions that we discussed were clarification on what really happens after you've been contacted for your contact tracing and what that 14-day monitoring period actually consists of. So for those of you that have my slide presentation, this actually pertains to the information on slide 5, directly related to the Michigan Department of Health and Human Services state contact tracing. And they call you the first time to inform you that your name was entered into the system by a friend or a family member that have indicated that they had contact with you and they are now positive for COVID-19. So the volunteer calls to inform you that you have been in contact with someone who is positive for COVID-19. They don't give you that person's name because that's protecting their privacy. And because they don't give you their name and they actually don't have their name, they're not allowed to see that name because we're protecting that person's privacy, even from the volunteers. So it is automatically a 14-day monitoring period that you're entered into. And so they explain to you what the process is and what you should be doing, quarantining yourself away from others to protect others in case you should develop COVID-19 yourself. And so then they, after they've identified your or verified your identification to make sure that you are who you really are supposed to be, then they will verify your phone number. They will go over the general information. They will tell you what you are supposed to do to quarantine. And they will ask if you've had a fever or chills or any of the symptoms that are related to COVID-19. And they're looking for either one of the major symptoms, which is that cough and fever and sore throat, or 2 of the minor symptoms, which can be vomiting, diarrhea, the loss of taste and smell, scratchy nose, runny nose, more cold-like symptoms. And so they'll go through and they'll ask you to identify if you've had any of those symptoms. And if you have not had any of those symptoms, then they'll simply wish you a good day and tell you that they'll call you back the next day. They call you back 14 days in a row so that we can monitor and see if you have symptoms. And if you develop symptoms during that time, your name would then be put back into the system as a possible or probable COVID-19. And then that gets kicked back to the state system on our side at the health department, where it then pops up on our screen so that one of our case investigators can call and further investigate how you've been feeling, when your symptoms started, and talk to you a little bit more and give you a little bit more information if you were to develop symptoms. I think I covered everything we talked about there, Yvonne. Did I miss anything?
Right. No, that's good. And I wanted to refer people to a previous webinar if they want to go back, and that full list of slides that you indicated are all in last week's webinar. We just wanted to touch on that particular piece because it was a question that was raised from last week. The other thing that was asked was, we know we have this outbreak in sequence, but once identified, if they're identified earlier, that monitoring may be reduced. We talked about this a little bit, and you said not necessarily. So can you just speak to that for a moment? Yes.
So when you're identified, if you know the person who you had contact with and you're able to, if that person called you and said, hey, I gave your name to the case investigator today, be expecting a call because I've identified you as a contact, then you know the person who you were exposed to, and you know the last date that you came in contact with them. So the 14 days, if we have all of that information to put together, the 14 days is calculated from the last day that you had contact with them. So say my Aunt Mary was a positive COVID, and I went to visit her on June 1st. And she found out on June 4th that she was positive, and my name got put into the system. Then they would call me maybe on June 5th, and they would tell me that they were going to do contact tracing and monitor me for 14 days because they don't have my Aunt Mary's information because that's been protected. I know that Aunt Mary is my positive person, and so if this were a perfect world and the health department were able to do their own contact tracing, if our numbers were small, then I would know what Aunt Mary's date was, and I would know what my date was. And because I had contact with her on June 1st, then I would only need to be quarantined through June 15th. Those are my 14 days. But because I wasn't contacted from the state until June 5th, my 14 days now are going to push out to June 19th. So it's 14 days. It has to be a minimum of 14 days that you monitor your symptoms, watch for a fever, watch for a change in symptoms, watch for a cough, anything that might develop into COVID-19.
That's great. Thank you so much. So we have to watch. Now, I just want to, again, this last slide, no agency is going to call to get any personal financial information. But before we get to that, you said something really critical about knowing who you've been around. And so one of the things that we're encouraging, and this is from some wonderful health professionals, because we are now demonstrating our social action by marching and being collectively together to make statements and rallies, it's important that even in those environments, you are paying attention to who you're around, because that call may come. And then you'll be able to know, I was in a large group of people with a large group of people, but I was around these particular people. And so I think this is where we call on our community members that are out and about and making their voices heard to be mindful of their own, protecting themselves and others around them by wearing a mask, but also paying attention to who you're associated with. So I just want to make sure that we're on the same page with that. And we're delivering a unified message there, Kim, when it talks.
Yep. That's exactly right, Yvonne. You definitely covered that. And we actually just received an updated email from the state today. One of the things that they're adding to they update our questionnaire almost weekly. But one of the things that they're adding for next week to our case investigation questionnaire is just exactly that question. Have you been out in a large community setting or a mass gathering setting where you may have exposed multiple people? So they're putting that in our listed questionnaire so that we can trigger those types of investigations.
Okay, and if you could just quickly cover this last slide here.
Yep, no agencies calling from the health department or the state. If they're calling in regards to COVID-19 or any other type of public health investigation, they will never ask for any financial, tax, or social security information, and the calls are never recorded.
Thank you, Kim. Appreciate that update. You talked about getting information from the state on a regular basis, a daily basis. And so we're going to now talk to Gary Jones. As Gary Jones is unmiking himself, we're going to put up, make sure you get all this information, because Gary's going to share a lot with us today. And we want to make sure you can connect with him so you can get specifics. While he's getting unmiked, I want to ask our panelists, we've got some questions in the queue. We want to make sure we get those questions answered. And hopefully all of you that have the availability to see these questions. I do want to ask one question. I think we still have someone on the line from the city. And I think this question is one that everyone might want to know the answer to. And it was, if you live outside of the city of Flint, but you're in Genesee County, can you still be a matter of the Black Lives Matter Advisory Council? And I see you're on, Dr. Reynolds. If I can ask you if that's a question that you can respond to for us right quickly. Dr. Reynolds.
Yes, I'm sure the first qualification is that you are a City of Flint resident.
I
To
actually
what
just got an
degree?
answer from Brian for that. There are 7 slots, and he said it's likely that they will all go to Flint residents.
Okay. All right. Thank you so much. I thought that might be a question of interest for everyone to hear. I think Gary's on mic now. So Gary, tell us what's happening at the state level. Okay, Gary didn't unmic himself yet. So while he's all right, there he is. Come on, Gary. I think you're ready now.
I unmuted him.
Okay, Gary Jones. All right. Well, while we're waiting on Gary, for those who were interested in that question, in the advisory council, I will give you the website for it. It is the City of Flint website, www.cityofflint, all spelled out, .com/2020/06/05 how to be a part of Flint's Black Lives Matter Advisory Council. Now that's a whole lot. I think if you go on the Flint website, you'll find a link to it. But please go on that City of Flint website and get that get that information. Are you up? Are you ready, Gary? Okay. Then while we're waiting for Gary, this is real time. We have one of our community partners on the line, and I'm going to ask if Aurora could be unmuted. Aurora is one of our community partners from the Latino Hispanic community. She's been an advocate and hard worker, and has been elevated to a new position and has opportunities for other Flint residents. So Aurora, good morning or afternoon now. Aurora.
Good morning.
Hey, there you are. Can you share with us this information you have about potential opportunities to make a difference in our community?
Definitely. So I started my new job on Monday, and my task is to hire between 12 to 15 navigators for the city of Flint. They have to be, they can be Genesee County residents, but they must work in the city of Flint, okay? Or else do their contacts in the city of Flint. They are it's a temporary position for approximately 6 months, and there is a $1,000 stipend. And so I'm going to send it to you, Yvonne, and if anyone is interested, they can let you know, and then you can forward that app to them, or you can refer them to me, and I will go ahead and send them the link.
Okay.
So basically, they're going to go out into the community. This is a grassroots position, so it is for individuals who have contact with residents, and it is for the entire community. We want to have a diverse group of navigators from all different ethnic backgrounds. So we need African American, we need Latinx, we need Arab Americans, Asian Americans, anyone that is interested in helping us out and getting the word out for this COVID-19. And because, as we know, there's so much information out there that a lot of community people get confused and listen to a lot of sides of what people think they should be doing. But the great thing is they required that I be part of this group, which I have been anyway, because they feel that you are giving us the correct information from the right sources. So I'm really happy about the new job, because I think that we can make an impact on our community by informing them and by letting them know, referring them to right resources. Although there are other agencies that are doing that, but this is going to be more a grassroots, down on the ground. So I'm excited. If you have any questions,
Aurora, I have one question. Can you give us what your title is for this new
Yes,
one?
it's a long title. It's Michigan United Public Health Grassroots Navigator Coordinator. Is
Okay,
that long enough?
you're right. It's a lot. But we're happy to know that you're going to be serving in that role, the opportunity for others to get involved. Is there a time frame, Aurora, from application, or when are you expecting to get applications in and get people up and going?
So our first round is right now until the end of next week. If we do not get enough applications, we will run a second round until we get all the 15 people, 12 to 15 people.
Wonderful. So for purposes of all of those of you that are listening to this opportunity, we will make sure that we put information up on our website for the HFRCC, so that you will know exactly the information that we're talking about here and can access that information. So again, we thank you, Aurora, for sharing that information with us. I want to appreciate everybody that signed in. I want to ask our community partners. Sharonda Grigsby is from the state of Michigan. I just want to see if you could open up your mic for a minute, and if there are any updates you want us to know about out of the Office of Health Equity and Minority Health Disparities.
Good afternoon, everyone. Yes, I just wanted to give a brief update. I reported back a couple of weeks ago, we've been working with the task force, and we've been tasked with standing up the additional 20 neighborhood testing sites. So last update I think I gave that we were looking to secure the vendor to help coordinate some of the logistics around standing up those 2 sites. We did finalize that contract with National Diagnostic Services. So we're working with them right now to conduct some of the site visits. We wanted to make sure that the focus right now is the accessibility, to ensure accessibility of the neighborhood sites. So we've started conducting site visits to those neighborhood sites that have been put into operation. We've conducted, there are going to be 2 sites visits today in Flint for the Word of Life Christian Church and Shiloh Missionary Baptist Church. And then we plan to visit the Beecher High School site next week to do accessibility evaluation for those sites. So I'll give you guys more information from those site visits as it becomes available.
Thank you, Sharon. And it's so great to know that the partnership that's happening with Flint, our Flint community, and the agencies and the state is working so diligently, because as we've learned, our community is really having a great opportunity to have access to these testing sites. We have more testing sites here than they have in some other major metropolitan cities across the nation. So it's really important for us to ask the questions necessary to get good information. But if you are interested and know that this is something you want, please access the testing. And ensure that you know for yourself where you stand. And as it was already said earlier, you may have more than one opportunity to do so. I have a couple more minutes. I see that we have Jim Melanowski from the health plan on the line. Jim, did you have an update for us today?
Yvonne, I'm going to defer. I know you have a couple other people. We're certainly here to help, but I know Dr. Reynolds, someone asked him a question, and I think he was going to respond live. So.
Okay, awesome. Thanks, yeah. Dr. Reynolds, we've got you unmuted.
Yes, if the question was about wearing goggles, yes, goggles may be appropriate for situations, especially if you want to reduce your risk further. And they also make face masks or face shields that you can wear. So yes, those things are available. And those options, say if you're working, that will depend on the setting and how you can maintain physical distancing and the level of risk that you're willing to assume.
Awesome. Thank you, Dr. Reynolds. And while you're there, any additional upsides from?
No, I mean, there is some glass on the flowers, but I can shake that off. It's just that,
you can also go to cdc.gov where there are
And I don't believe it
guidelines
was
for
the driver
employers
that
and
delivered
for
because
specific
I was
industries.
watching him when he put it on my.
Thank you so much. I know we have a number of other community partners online, and for those of you that have that ability to mute yourself, we appreciate that. But we want to say to each and every one of you how important it is, again, that your voice is heard. This is one venue of many. We appreciate every time you ask us a question because it allows us to get some additional insights. I want to give you a tip for next week. Next week, we're going to hear from representatives from our hospital systems to give us some more information and understanding about what's happening in the hospitals right now, not only to help protect us from the virus, but also to take care of what we know are already health needs that we've talked about for so many years as it relates to health and health disparities. In a moment, you'll receive your evaluation. As we prepare to close today, we're going to ask you to continue, please continue to send us those questions and respond to the survey at the end of this. And we'll look forward to seeing you next week in another Flint community webinar on coronavirus and the other issues that are so relevant to our community today. Thank you. You can like us on Facebook and please, join us. Join us. Subscribe to the YouTube channel. And then that'll help us be sure when you click on Healthy Flint, you will be sure to get all the information that we have available to you. Again, I want to thank you for joining. Be safe, protect yourself, and remember, when you protect yourself, you protect others as well. We'll look forward to seeing you next week.